Welcome, everyone. Sometimes in the midst of a huge global health crisis, we tend to focus on the big things, right? Like hospitals being full or the World Health Organization declaring an emergency. But what if the real, decisive moment actually comes much, much earlier? Or when a young man starts vomiting, but he's genuinely afraid to report it because he's seen what happens to families labeled as Ebola contacts. Like, no way, that's a huge barrier. It's not about the science at that point, is it? It's about something much deeper. Yeah, it really is. Because when people believe hospitals are places where they'll just disappear, what do? They hide, right? When they fear isolation, they run. And when they distrust officials, they'll remove bodies and take them back to their villages for traditional burials, which, while culturally significant, can unfortunately become a vector for spread. So what's the answer then, The text talks about needing a new front door. And it's not a hospital front door, and it's not a foreign agency front door. It's a community front door. And that's where Prema Kiosk, powered by Dr. Maya AI, comes into play. It's brilliant, really. That's such a crucial point, because you can't blame the patient for trying to get help, or for going to family, or sitting in crowded vehicles. The answer is to create a trusted, local, multilingual system that gets to them early. And the cool thing is, a Prema Kiosk doesn't even have to start as fancy hardware. They're there to build trust, guide people on how to use the system, protect their confidentiality, and then connect suspected cases to the authorized public health teams. They're not there to diagnose, They're the bridge. And Dr. Maya AI is the brain behind it all, the reasoning core. Exactly. For Ebola, it wouldn't pretend to confirm a diagnosis, because only laboratory testing can do that. But it can recognize a high-risk story: fever, weakness, vomiting, diarrhea, bleeding, contact with a sick person, attending a funeral, touching a body, or travel from a known affected area. That's key, isn't it? Oh, I love the color-coded logic developed by Dr. Kadiyali Srivatsa. Blue means infection risk. Blue means isolate. Blue means do not travel. Blue means protect the family and community. And red signifies danger and medical escalation. So if you see a red-blue pattern, that tells you the person might be seriously ill and infectious, and that's when the system triggers swift human follow-up. It's smart. Yeah, it's all about prevention, and the way an Prema-enabled Ebola response could operate, it's like a step-by-step guide. First, a suspected patient or family member contacts a guardian, scans a QR code, or uses a smartphone link. The system then asks simple questions in the local language, gathering all that crucial info. And then contact tracing happens swiftly. Who shared a house? Who cared for the patient? Who touched their vomit, blood, or bedding? Who attended the funeral? Who traveled in the same vehicle? All those critical contacts can then receive daily symptom check-ins for the incubation period. That's huge for containing spread. That's where the guardians come in again, right? They coordinate food delivery, reassurance calls, spiritual support, and referrals to official responders. It's not just about the tech, it's about the human connection. And the system can even create anonymized community heat maps. Exactly. And my favorite part of all this is how Prema Guardians can transform safe burial. Instead of it being a foreign order, they make it a community-respected ritual. Priests and elders can explain that love doesn't require physical contact. Love means protecting the living. Families can be offered prayers, video memorials, witnessed burials, and dignity, all without dangerous contact. It's so culturally sensitive. And the best part is, this can begin within 72 hours, not by waiting for new machines or perfect national rollouts, but by deploying the online Prema system on smartphones and computers, training local guardians, translating key scripts, creating emergency QR access points, and connecting those high-risk cases. The gap between the first symptom and the first trusted action. In Ebola, every hidden fever, every unsafe funeral, every missed contact, every frightened family matters. The world doesn't need another system that waits for people to arrive at hospitals. It needs a system that listens before people run, guides before they panic, and protects before infection spreads.